Welcome everyone to our Living Your Best Life webinar. We are very excited to speak with you today about physical therapy for neurological wellness. This is an area that Rose and I practice in every day, and we are really passionate about bringing education to the community about what physical therapy can do in the neurologic space. So with that, let's get into it. As we discuss neurologic wellness today, let's start with an introduction to the nervous system. What is the nervous system? Well, it is our body's command center. It's made up of your brain and your spinal cord and the nerves throughout your whole entire body. Your nervous system works by sending messages like electrical signals between your brain and all of the other parts of your body. These signals tell us to breathe, to move, to speak and see, for example. And our nervous system keeps track of what's going on inside and outside of our body and decides how to respond to any situation that we're in. Our nervous system regulates complicated processes like thoughts and memory as well, and it plays an essential role in all of the things our body does without even thinking, right? Things like blinking, breathing, sweating, sleeping. So the nervous system is responsible for a lot, really every part of our daily lives. And that is why understanding it and understanding what we can do to keep our nervous system healthy is so important. As we go today, we're going to talk about the most common diagnoses that we see that affect the nervous system. Rose and I will break these down by diagnosis, and then we will talk about how physical therapy can impact you or someone you know who might be dealing with these conditions. So we will start with stroke. Stroke is also called a cerebrovascular accident, or you might hear it called a brain attack, similar to a heart attack. Stroke occurs when something blocks the blood supply to a part of the brain, or when a blood vessel in the brain bursts. In either case, parts of the brain become damaged or die. And with that, a stroke can cause lasting brain damage, long-term disability, or even death. But the good news is that there's a lot of treatment and recovery that we can do to bring recovery and more function to the nervous system after a stroke. Stroke is very common. I think that most of us know someone or have experienced a stroke in our daily lives, but it's important to recognize how common it really is. There are 7 million stroke survivors in the US right now. So with that, there is a lot of research and a lot of data on how physical therapy can impact folks with a stroke. Additionally, we recognize the healthcare costs and the impact that this can have on our communities. There are a few different kinds of stroke that we can talk about. I mentioned that stroke is when blood flow to an area of the brain is impacted, but this can happen in a few different ways. We can have a blood vessel that's blocked by a blood clot, or we can have a blood vessel that is bleeding. And additionally, there's a type of stroke called a transient ischemic attack. Sometimes you might hear this called a mini stroke or a warning stroke. This is a type of stroke that is just like any other, but it's on a smaller level where blood flow to the brain is blocked, but normally for a shorter amount of time, and the impact is lesser and recovery is greater. The important thing to know about a transient ischemic attack or a TIA is that this is a warning sign. If this occurs, this isn't something that we should take lightly. It's typically a sign that something major could happen if we don't take action in treating. And with that, it's important to know the risk factors. What things might make you more likely to have a stroke or an issue with blood flow to an area of the brain? The first and biggest one is high blood pressure. This is so significant because when we have high blood pressure, that stresses the blood vessels in the body and the brain. And over time, this can create risk for, again, either a blockage or a bleed in the brain. I don't know about you, but I think sometimes high blood pressure can be minimized because it is so common. But it's really important for us to recognize that if high blood pressure is not treated, that it puts us at a significant risk for stroke. Other risk factors to be aware of are age. The older we get, the older those blood vessels get, and more at risk for having an issue there. When anyone with diabetes is at a higher risk of a stroke, as well as a history of smoking. Now, if someone is an active smoker, the risk for a stroke is much higher. Every day away from smoking, the risk factor for stroke goes down. So that's really encouraging for us to see that no matter what point in life, if we can work on smoking cessation, that the risk factor or the risk of having a stroke can decrease. And then we also have the condition of obesity or sedentary lifestyle that can play an impact in the risk for stroke as well. One thing we want to be aware of is the warning signs for a stroke. We know that this can happen quickly in the brain, but how would we know that we or someone in front of us might be having a stroke? Well, the acronym here, FAST, is a really great way to think about this. So normally when we have a stroke, the person will be experiencing face drooping, typically on one side of the face, not the muscles not having activity there. Also typically on that same side having arm weakness and or difficulty speaking. And the T really helps us remember that we need to act fast, act quickly. If we are concerned that ourselves or anyone else is experiencing a stroke, calling 911 immediately allows us to have time for medical attention. And the sooner a stroke is identified, the sooner it can be treated and the better outcomes we can have. Okay, our next condition that we'll speak about today that involves the nervous system is multiple sclerosis. So you might hear this called MS. This is a potentially disabling disease that involves the brain and the spinal cord. So the two main parts of the central nervous system. In MS, what happens is the immune system attacks the protective sheath that covers the nerves. This is called myelin. So the immune system, for some reason, is attacking this area of the nerve, and over time, this causes demyelination or scarring of our nerves. And this is a progressive disease. So this does get worse over time at varying rates depending on the individual and depending on the medical intervention. But what happens is when those scars are on the nerves, they cause decreased communication from one nerve to another or from the brain to the body. And depending on where this damage or these lesions are, each patient with MS can present with very different symptoms because different parts of the nervous system are affected. I like this diagram here on our right-hand side that shows the MS symptoms. This diagram was made off of some research polling a lot of people with MS to understand what symptoms they were experiencing. And again, because different parts of the nervous system can be affected here, this can look really different in every person. The symptoms that are in red, numbness and tingling, fatigue, pain, muscle spasms, and walking difficulty, those were the most commonly reported. You can see though, right behind that, those in blue, then next those in green, and those in yellow being the more rare symptoms. But these are all of the different symptoms that can come from the nervous system being affected by multiple sclerosis. Additionally, we know that there are 2.3 million people living with MS worldwide. And this affects women to men in a 2-to-1 ratio. MS is typically diagnosed somewhere between 20 and 50 years of age. And there are a few different types of MS for you to be aware of. The first and the most common is relapsing and remitting. What this means is that the inflammation or the attacks on the nervous system come in bouts of attack and then recovery or remission, and then another attack. And so the frequency and the intensity of those attacks can be very different depending on the person. But that is the relapsing and remitting type of multiple sclerosis. The other type is primary progressive, which slowly gets worse or progresses over time, but without clear, distinct attacks and remissions. And then there's also a type called secondary progressive, which means that it starts out with the kind of peaks and valleys that we see in relapsing and remitting, but then over time, the condition becomes slowly progressive. So it's really important for you to understand what type of MS you have, and also based on that, the best way to treat that condition. And there are some different risk factors that make someone more likely to have multiple sclerosis. There is a component of genetics or family history. We also know that those with Northern European descent are more likely to have MS, and that there is a relationship between different climates. Those in more temperate northern climates or areas with low vitamin D due to low sunlight are more likely to have an MS condition. There is also an association with the Epstein-Barr virus, and those who have that in their history are more likely to get MS down the line. And then those same risk factors we talked about with stroke, smoking, and obesity, they stand here too. We know that those are things that have a negative impact on our nervous system and make it more vulnerable to any type of disease. So as you can look at the condition here, you can see our picture of a healthy nerve on the left and a nerve that's dealt with some of that inflammation and scarring on the right. And you can see how that can create these various symptoms that we're looking at here. So MS can be hard to diagnose for all of the reasons that we've discussed here, for how different it can look and for the different types of multiple sclerosis. But the good news is that there is a lot that can be done from a medical and a physical therapy standpoint to impact those with MS.
Okay, well, I'm going to pick up from there talking a bit about Parkinson's disease. So Parkinson's disease, often referred to as PD, it's a type of movement disorder, and it progresses over time. So the initial symptoms are relatively mild. It might be a slight hand twitch, a loss of an arm swing when you're walking. But as the disease progresses, the symptoms are going to become more pronounced. So the symptoms in Parkinson's disease occur essentially because there's a lack of dopamine production within the brain. So dopamine is a chemical that helps move signals from the brain to the muscles within your body. So if you're lacking on dopamine, the signal is not getting to your muscles the way it should. And I've seen some studies that say, before someone's diagnosed with Parkinson's disease, they've lost as much as 60 to 80% of their dopamine producing cells. So there's already a very significant amount of damage within the system before you're even diagnosed with the condition. So the typical motor signs that you're going to see for someone with Parkinson's disease would be like a slowness of movement, which is referred to as bradykinesia. You'll see rigidity or stiffness kind of throughout the body. There'll be shaking or twitching, which is referred to as tremor. And often there's a characteristic walk. It's called like a shuffling walk or a shuffling gait, which happens to look like a slow, small steps that kind of almost stepping upon the next step. You're not advancing through. So that can lead to instability as things progress. There's a lot of other symptoms that go along with Parkinson's disease beyond just the motor symptoms. Some of those include like anxiety, depression, speech changes, sleep changes, dementia is possible. And really one that can be very problematic is called freezing of gait. And that's where those steps get kind of so small that they sort of stop altogether and you get stuck. That's kind of a common presentation you'll see with a more advanced Parkinson's condition. So currently there's no cure for Parkinson's disease, but there's a lot of therapies and medications that can help to reduce the symptoms associated with Parkinson's. Parkinson's disease, I think most people think of in more in the older population, but certainly there's a lot of younger people too that have Parkinson's. A lot of people can be diagnosed in their 30s or 40s or even 20s. Michael J. Fox, as an example, was diagnosed, I think, at 27. So it can happen early, but more often we're seeing it in the aging population. They found that the prevalence of Parkinson's disease over the last 25 years has doubled. They're seeing it more and more, and they expect that by 2030, that it's going to be about 1.2 million people in the United States that have Parkinson's disease. If you look at the data, there's a little bit more men that have Parkinson's disease than women, and that's kind of leveling out a bit. And I think initially that was kind of because we thought occupational exposures were kind of at the heart of that. So different environmental factors can have an impact at putting you at a higher risk of Parkinson's disease. That's like pesticides, air pollution, industrial solvents. It was true long ago that women weren't working in those type of conditions and that they were less likely to come in contact with this. But certainly things have changed over time and more women work in those type of conditions. So it is kind of sort of leveling off a bit, and it's getting pretty close to being more equal between men and women. There is a familial or a genetic component to Parkinson's in some cases, but not all the time. Often it's considered to be what's called idiopathic, meaning they have no idea why you have it. It happens. Just want to note here that although Parkinson's disease is the most common movement disorder, there's a lot of other movement disorders out there that have some similarity to Parkinson's disease that I kind of want to pay a little bit of attention to here. The ones I've listed are multiple I can talk today, I promise. Multiple systems atrophy. That one often looks a lot like Parkinson's, right? That one looks, it's a Parkinsonism, and often the features will be very similar to Parkinson's, but the medications generally do not have a good impact on MSA. Another condition is Lewy body dementia. That one might ring a bell because Robin Williams had Lewy body dementia. And Lewy body dementia is referred to as LBD or DLB. It's the same thing, but essentially that is a combination of Parkinsonism along with dementia, where the dementia is the primary component and that the Parkinson, the movement part of it, is kind of secondary. So that kind of goes, again, is labeled as a Parkinsonism. There's also listed here corticobasilar degeneration, and that's kind of a diffuse degeneration in different portions of the brain. And some of those characteristics are a little bit different, with flailing arms sometimes seen, and a lot of cognitive changes associated with that condition. And the last one I have listed here, progressive supranuclear palsy. Again, these are all not as common as Parkinson's disease, but progressive supranuclear palsy, quite a few people have this condition as well. And it has some Parkinsonian symptoms like, tremor, rigidity, some of those other things. But there's a lot of almost like an inner ear vertigo-y type of feel to this condition. It has dizziness along with movement problems, and it also has cognitive changes associated with it. And although we're not going into a huge depth into these Parkinsonisms, I just want to take a moment to talk about those because, these are something that maybe you're on the call because you have one of these conditions. And I just want to kind of let you know that a lot of the things that we do for people with neurological conditions in general, a lot of things that we do for people with Parkinson's specifically are going to have an impact on these conditions that I have listed here. Em's advancing my slides for me. Thank you so much, Em. All right, so all these conditions that we listed, we just wanted to let you know that physical therapy can be very helpful, very impactful, and those that have neurologic conditions. Even in those conditions that are progressive, the research backs up doing therapy for these conditions. They do help. So the research shows that physical therapy can improve the severity of your symptoms, can improve your quality of life, improve your overall movement, and help improve your functional performance. So neurologic physical therapy can be done in many different settings. Emily and I both work in what's called an outpatient setting. So we are not in a hospital per se. We're in a separate clinic outside of the hospital. But you might work with a neurologic physical therapist at a rehab facility or rehab hospital, potentially home therapy. You could do physical therapy at home. So there's a lot of different ways you may interact with a neurologic physical therapist. And certainly that may change over time too. When you're more mobile, you might be in our outpatient clinic with me and Emily. And then as mobility becomes more of a challenge, you might be doing it more at home. So what I'd like to kind of point out that each person and each condition has their own unique collection of findings and challenges. And although we're going to follow guidelines that are based in research, obviously, ultimately, our plan is determined by what your challenges are, what your specific issues are, what are your symptoms. That's what helps guide what we do in our therapy. So I just want to point out, if some of you may not be as familiar with physical therapists, so physical therapists, we are highly trained to work with your musculoskeletal and nervous systems. Our entry-level degree coming out of college now is a doctorate. So we do have quite a lot of education and a lot of hands-on training even before we graduate. We're trained to improve your ability to move, which translates to an improvement in your ability to work and do your home and daily activities. We're here to keep you physically active and to keep you moving the way you need to do to be in your community and do what you need to do. So with neurologic conditions, there's often symptoms beyond just the physical movement aspects. We touched on that just a little bit with the conditions we were talking about. So our job as physical therapists, we're going to work closely with all members of your team. So your team, depending on what your symptoms are, might include speech therapists and occupational therapists, maybe nurses, maybe physicians, neurologists, psychologists. So there's a lot of components that go into what's called an interdisciplinary team. We each have our own roles, but certainly what we try to do is to communicate with each other to get your needs in check, to keep you healthy and keep you moving. So as physical therapists, we try to do our best, certainly, to be an active member of that team. Got it, Em? That little delay, I know. Thank you, ma'am. All righty, so once you come in for physical therapy, or once your physical therapist is at your home, we're going to determine which plan is going to help you to attain your goals. So one important component of that comprehensive PT treatment, once we look at everything, is strength training. So your evaluation, we're going to look at which muscles or which groups might be deficient. And from there, we can target whichever muscle groups are going to help to improve your daily function. So this might be your postural muscles, which are going to improve your posture for when you're walking or when you're trying to balance. It might be the muscles in your legs to help you advance your feet while you're walking. This could be improving shoulder strength, which will allow you to reach or lift. And again, it's going to be dependent on your condition and dependent on where your specific deficits lie. So these strength exercises, again, they're going to be specific, but they're also going to be performed at a relatively high intensity, right? We're not going to give you the tiny, tiny weights. Granted, I'm not having you lift a car, but we want to challenge you. So we're going to try to find the resistance that's going to challenge what you need to do. And these exercises are going to be performed several days a week. So when Emily and I see you, or whoever your therapist is, we're going to prescribe you exercises that we're going to do in the clinic. And also we're going to give you things to work on at home. So by performing these strength training activities on a more regular basis in home and in therapy, that's going to help improve that connection between your brain and your muscles. Often that connection is disrupted with neurologic conditions, right? Emily showed you the nerve, right? When you have MS, that the nerve signal is not getting there. With Parkinson's, the dopamine is not allowing its signals to come. When you have a stroke, that change to oxygen within your brain temporarily disrupts that. So what we're going to do is to try to find ways to improve that connection. And by exercising, that can certainly help that. So our goal with strength training is to improve your functional strength, which means improving that muscles that help you with functional activities like transferring in and out of your bed, maybe getting up from a chair or reaching into your cabinet. So these are all activities that you need to do in everyday life. And what our goal is to get you back to doing those things that you need to do.
So another common area of focus after strength is fatigue. This is definitely something that is a common symptom in many neurologic conditions, whether it's the ones that we talked about at the beginning or really anything that impacts the nervous system. Fatigue is a really common complaint that Rose and I and our other neurologic PTs hear about in our sessions. But I think we often get the question of what really is fatigue? Like, why is this happening? What does this mean? And it's really an overarching symptom or a kind of umbrella type of symptom where a lot of specific feelings can fall underneath that. So some people might talk about it as just feeling low energy. I love this picture, like, hey, my battery is drained. I don't have the energy or the gas in the tank for the activities that I need to do in my life. Things that used to be easier now feel more draining. Fatigue may also present in how we're sleeping. So quality of sleep might be interrupted. It might also feel like you could sleep and still aren't feeling rested. Within neurologic conditions, sleep can often be impaired and be related to fatigue. Fatigue may also be described as brain fog, or just not being thinking clearly or not as sharp, or sometimes people say their brain is overwhelmed and fatigued. So that's very common. And then fatigue can also be a part of pain, right? Our brain has to process pain from whatever condition is going on in our body. And these things kind of work together to build into fatigue. So if we're already low on sleep, which means low on energy, and then our brain is also overwhelmed with pain, this can lead to the state of fatigue. So now that we know what fatigue is, what do we do about it? Well, of course, as a physical therapist, I'm going to say exercise is the answer. But the good news is, while fatigue means a lot of things and is really prevalent, we do have a lot of research and data that shows that exercise is the best known treatment. Now, we're going to talk about a lot of different exercise here, whether that's strengthening exercise, as Rose shared with us, or mobility exercises, moving our bodies and working on the benefits for our cardiovascular system, our heart, our lungs, our blood flow. All of those things create a healthy nervous system, which is the best tool to fight fatigue. In physical therapy, not only will we teach you the best kind of exercise for your body and for your fatigue, but we will also teach you different strategies and concepts. The most common one we call energy conservation. So what does this mean? Well, I like to think of this guy here with his battery. I know we all have a cell phone. I don't know how your battery life is on yours, but mine's not so great. And that's something we have to manage every day, right? Well, our neurologic fatigue, our energy that we have is very similar to a battery. We need to conserve that energy and understand how we can use that across a day or across a week. So in physical therapy, we can teach you things to charge your battery, things like exercise, things like rest, things like efficient mobility, not burning all of your energy doing certain things. And we can also give you examples for how to make your battery life last longer throughout the day. Um, Things like getting stronger, walking better, using tools or tricks or strategies that we teach you in therapy. We can have a really big impact on your energy conservation so that even if fatigue is present in your life, you can still do all the things you need to do. Another area that we can impact in physical therapy for neurologic specifically is mobility training. This is one of the biggest goals we hear. When we work with our patients, especially our first visit, we want to know, why are you here and what is your goal? And a lot of times we hear, I want to walk, or I want to walk better, or I want to walk differently, or I want to walk more, right? And here in physical therapy, we are the experts of helping you move around better. We want to understand your walking goal, not only that you want to walk, but what does walking mean for you in your life? Does it mean getting to your appointments easier? Does it mean getting to travel and be with your family? Does it mean getting from your bedroom to the bathroom easier? And we can really tailor our treatment to what your walking goals are. We also have different tools that we can use to make you more independent with your walking. So the first thing is assistive devices. A lot of patients come to us saying, I think I maybe need a cane or a walker, but I don't really know. And I don't know how to use them, even if I do have them. So what we can provide in physical therapy is specific testing to identify what assistive devices like a cane, a walker, a walking stick, crutches, a wheelchair, what's right for each individual? How do we help them get the equipment they need? And then also how to use it and training you and your family to use it too. Very similarly, in physical therapy, we work with orthotics. So these are things like, ankle or leg braces that can help you walk and move around more easily in your daily life. We typically work with other professionals who make braces if we need custom orthotics, or sometimes we can recommend something that is as easy to get at, your local drugstore or off of Amazon. We can help you figure out what you need. And the cool thing about orthotics are typically those are something that can help someone be more independent in their walking without relying on others to get around. So these are both assistive devices and orthotics are great tools that we can help someone with to walk and move more independently. We think it's also important to talk about the different levels of mobility. We work with patients to individualize what they can do at home versus out in the community. For example, some of my patients need a walker when they're going to the grocery store or to doctor's appointments, but when they're in the house, they don't need to use an assistive device. We can give you advice on different types of mobility based on what your demands are. And we are also the experts at preventing falls. Rose will talk about balance in just a moment, but with mobility, that's something that we really can help build independence and safety so that our patients can be safer for the long term by moving in the best way. And very similar to what Rose shared about strength training, in mobility training, we have a lot of information that tells us how we need to train. So we know that high intensity training, at least 2 to 3 sessions a week in therapy, and again, homework outside of therapy, that is what's going to be enough to make the difference to improve someone's mobility. So in physical therapy, we will challenge you to work hard and to take a lot of steps or to do a lot of motions and to be able to do that in a way so that when you leave therapy, you are able to do more on your own. On the flip side, we also are the experts in working with wheelchairs when walking is not an option, right? Some people walk in the home, but in the community, they use a wheelchair. Other people, as their condition progresses, need to use a wheelchair more and more. We can evaluate and help you find a wheelchair and find the best one, as well as train you how to use it or train your family to help you. There's a lot we will do for mobility, but I alluded to balance, so Rose, fill us in.
I would love to, Emily. So balance impairment is a big concern for so many people. And I have a feeling, just by looking at a couple of the questions that I've come across, I think balance is a big issue for people. So this is certainly an area that's a big concern for people who have neurologic conditions. But as you know, balance impairment is going to lead to falls, right? And if you look at the information that comes out of the CDC, falls are the leading cause of death in older adults. So they said in one of the stats that 25% of Americans over the age of 65 fall each year. And that's not just the one with neurologic conditions. So keep that in mind. That's everybody over 65. So these falls can lead to fractures, head injuries, concussions, and it accounts for 3 million ER visits per year. So there's different factors that put you at a higher risk for falls. And of course, age is one of those things. Prior history of falls is another. And the third one, which actually correlates with several of the questions that were in the chat, is sensory changes. Changes in your ability to feel in your legs, particularly, can have an impact on your balance. And that's because your balance system includes 3 sensory components, right? So number 1 is your vision. Your eyes show you what's going on. They let you know what your orientation is. And certainly if you have vision issues, that can cause a little bit of a problem with your balance. So next would be your vestibular system. Your vestibular system, or your inner ear, it's kind of your gyroscope. Your inner ear tells you if you're tilted, it tells you if you're leaning, it tells you if you're moving. So that vestibular system is very important for kind of telling you what's going on. And then lastly is that what's called proprioception, or sensation. And that comes from your joints and your muscles. A lot of that is in your feet. That's a big part of it. But certainly it's also within your hips and within your neck. And there's a lot of different information you get from all different parts of your body. So as that information comes together from those 3 systems, it goes into your brain, and your brain takes that and figures out what to do with that information. It processes it. So now we know there's 3 sensory systems and then the main processing center. So if there's an issue with any one of those 3 sensory systems, let's say you have a problem with vision, you're low vision, plus let's say you're diabetic, so you also have neuropathy in your legs, you have difficulty feeling. That's already 2 systems that have been impacted. So your brain is having to kind of figure out who to pay attention to, and it's having to kind of process and figure that out. So let me throw in the mix. Let's say we have an issue with the central processing center, with our brain. Let's say we've had a stroke, or let's say we have some kind of condition that's impacted our brain. Now, the central processing system's been affected. So certainly all of these factors can kind of lead to less accuracy with our balance reactions. So to answering the question about the neuropathy, by working on balance, by working on your ability to move through things, that's going to help with that. So what we do in therapy, if you have trouble with your balance system, is we take a look at all of these things and we decide what's going to help you improve that. I'm going to point out that exercise and physical activity just alone, exercise and physical activity helps to decrease your fall risk by 12%. And that's a great stat, right? Just moving and getting going is going to help you. So cardiovascular and strength training do have a great impact on balance. And that's certainly something that we're going to do in therapy. But what we'll do as balance experts is we're going to look at which systems are most impacted and find ways to do exercises that help improve those systems if we can. So now the exercises will start off a little more static. That might help your balance when you're steady standing, but we're going to improve those and make those more challenging and progressive as we go so that you're able to maneuver in balance when you're not standing still. So these activities are going to challenge several components of your balance system, your eyes, your ears, your feet. So it's going to be all kind of included. Again, high intensity, like Emily said, working our way up and challenging you through all these activities. I want to take a quick moment and just talk about what dual task activity is. So dual tasking is a very important component of balance training. And this is going to help you be able to do more than one thing at a time, right? Like talking while you're walking or carrying something while you're on an uneven surface. So doing 2 things at the same time can be pretty problematic. So our goal in therapy is to try to get you back to doing those things that you need to do that require those higher level challenges to your balance system. Thank you, Anne. All right, so I can't talk about and throw the vestibular word out there without chatting a little bit about dizziness. So Dizziness is common as we age anyway, right? Because our sensory systems have been changed, but it's seen in conjunction with several neurologic conditions. Certainly, there's a lot of conditions that cause dizziness, imbalance, or even vertigo. So I just want to kind of clarify a couple words here that are on the slide. Dizziness and vertigo, right? Vertigo is a sensation of spinning. I'm in Central Florida, so my best analogy is the teacups. So you're in Disney World and you're on the teacups and it's spinning you around. That twirling sensation is vertigo, okay? And that's a bit different than what you think of with dizziness. Dizziness can be things other than just true vertigo. It can be a sensation of a lightheadedness. It can be like an imbalance. So it's a little bit different. So if vertigo is your primary symptom, we have a lot of therapists, physical therapists, that can help you with your vertigo symptoms. You're going to work with a vertigo specialist who's going to help you with that. So dizziness obviously is a little bit different. So dizziness is more of a vague symptom. So there's a lot more generalized dizziness is going to be a little bit different when we attack that. And often that dizziness or imbalance is due to the sensory changes in your body. So I mentioned before, diabetes can do that, but certainly MS can have a change on your symptoms and your sensation in your lower body and many other conditions. So when these sensory changes happen, we take a look and we decide, you know what, this is the thing we need to work on. Let's do some exercises that work on your vestibular symptoms. Visual issues are kind of the primary. Let's teach you some compensation activities that show you how to maneuver through the environment when you don't have the ability to see. I want to take a quick moment too to talk a little bit about something we see a lot in the neurologic population, more so in the general population, which is called orthostatic hypotension or postural hypotension. What that is that's a symptom that as you stand up, your blood pressure can drop. And that's seen with people who have spinal cord injuries, that's seen sometimes in MS and sometimes in people even post-COVID, I've seen it. But it happens quite a bit in people with Parkinson's. So I want to take a minute and mention that might be a possibility. And certainly, as I mentioned before, whatever components of your balance are contributing to your dysfunction, we're going to take a look at those and we are going to work on those systems, specifically working a lot on different balance activities. All right. And since Parkinson's is my love, I work a lot with people with Parkinson's, and that's why Emily and I decided that was going to be my part of this conversation. But certainly, there's a lot of different specific programs out there for Parkinson's. So I want to kind of chat a little bit about some of those things. So task-specific training is a very important component of Parkinson's disease care. And certainly we use that with other conditions as well. But what task-specific training is let's say you or your care partner and your therapist are working together and figuring out which things are most difficult for you. So for you, if it's dressing, right? We're going to look and see which part of dressing is difficult, right? Is it that you can't lift up your leg to get your foot in and out of your clothes? Is it that you can't reach your arm up to get your shirt on? Is it that your hands, you have difficulty with dexterity, so you can't tie your shoes or button your buttons? So what we do as therapists is we kind of dissect what things that you have difficulty with, and we find ways to work on those activities to make them easier for you. And we do that through repetition and through practice. And that's a lot of what we do specifically with Parkinson's, but with other conditions as well. I talked a little bit about dual tasking, and this is a very important component of Parkinson's care. As Parkinson's disease progresses, it can be very difficult to do two things at the same time. So we can practice working on the components separately, like, I can't get up from the chair and grab my coffee mug. So we'll practice getting up from the chair, and then we practice lifting the coffee mug, and then we put it together. And then we challenge you by making you talk while you do it. So these are just ways that we can challenge you and make the things more difficult, but that are practical to your life demands. The other thing I have on here is external cueing. So external cueing can be a bit confusing when I put big words up like that. External cueing, what that is your therapist is going to provide different cues to help improve the quality of your movement. Those cues can be, it could be an auditory cue. It could be a beep. We can have a beep, or we can have music even that gives you an auditory cue to tell you how quickly to step. We could provide you with a visual cue. We could show you how to do the movement. We can manually move you through the movement. There's a lot of different things we do. Visual cues with a laser. So there's a lot of different ways we can cue you to improve the quality of your movement. Two of those programs I have listed, LSVT Big and Power. If you have Parkinson's disease, you may have heard of these two types of programs. They're specifically geared towards people with Parkinson's. And what they do is to cue you to move bigger in your everyday life, to take a bigger step, reach big, step big. And I just want to take a moment to throw those on there, because there's a lot of therapists that we have within our own company that specialize in these programs. So if that's something you've heard of and was something you're really interested in, we do have providers that do that as well. All right, back to you, Em.
Thanks, Rose, for speaking on PD. Some specific considerations for stroke are coming next. So really important to recognize that the most common presentation of stroke is weakness. So we might see that called hemiplegia, which means one side of the body is weak. And specifically for neurologic physical therapy for stroke, we will do all of the things we've discussed, but we will have a higher emphasis on strengthening and getting as much strength back after that stroke as possible. But it's also important to remember that some of those changes may be with us for the long haul, and we might need to consider compensation techniques instead of recovery techniques. So we can teach you ways to work with your weakness to still be able to do what you need to do. We typically get some questions about using electrical stimulation. That is something that we do in physical therapy when appropriate to gain more strength after a stroke. And that is individually prescribed based on each person's condition. Your physical therapist can help you with that. And then transfers are something that come up a lot in stroke. So these are how we move from one position to another. So getting in or out of bed, getting from a chair into a standing position, or from a wheelchair into another chair. That is something that you will see in all neurologic conditions, but definitely a high emphasis when we're working with patients with stroke. And we can help increase independence in those transfers or train a caregiver to help as well. And then our last condition is MS, right? We talked about that earlier, and we talked about the variable presentation that we can see with multiple sclerosis. But one thing to highlight is just the individualism that comes with treating this condition in particular. So depending on what type of presentation the patient has or what stage of the disease, the physical therapist can help come up with an individualized program. We definitely have to take into account fatigue in all neuro conditions, but especially with MS, because we can overdo it easily. So that's one thing that your PT can help you find the right amount of exercise that's safe without doing too much. And we can also help manage heat intolerance, which is another big piece of multiple sclerosis. A lot of times we don't really have tolerance for hot weather, humidity, or for overheating from a physical capacity. Rose spoke beautifully about dizziness. Dizziness is very present in the MS condition as well. So we will help address that. And the big thing to know about MS-specific physical therapy is exercise is key. Whether it's for fatigue, heat intolerance, dizziness, strength, exercise is the biggest impact, and your physical therapist can help you figure out the right type of exercise. Now, we've talked a lot about when there's problems in the nervous system, but Rose, can you tell us about even when the nervous system's doing well? We're going to go through some aging, huh?
Absolutely. So we all have nervous systems, of course. So even if there's no medical diagnosis that's impacting your nervous system, we do need to consider that aging of the system can have an impact on your life. Just like any system within our bodies, right? Our joints get older. So our brain and our nerves have some impact from aging as well. So as we get older, our nervous system the sensory components may not be working as efficiently. We might have some issues there, or perhaps the processing might be a little bit slower. And certainly as we age, we can have a decrease in our mobility. We may experience falls. I gave you that stat before, but certainly all of those things can have an impact on our quality of life. The great news is exercising and caring for the nervous system can certainly help you to stay healthy. So with your therapist, you can help identify which balance problems are present and which sensory symptoms are kind of contributing to that. We can take a look at that, pick it apart, and figure out what to work on. It could be the vision system, the proprioceptive system, and strength, any of those things. It could be an abundance of other factors that are kind of going in here. But the exercise is going to improve your mobility. It's going to improve your overall feeling of well-being. It's going to have a positive impact on all of your body systems and help you decrease that risk. Exercise is going to improve bone strength, strengthen your heart, your circulatory system, improve your breathing and oxygen levels throughout your body. And this all stimulates your brain. The brain loves oxygen. Getting it moving and going is going to be very helpful. An active brain is going to be a healthy brain. And honestly, exercise truly is the best medicine. And I know we put that on every slide, but it's absolutely true. And Em's going to go on to the next slide. So what happens when, we can't see you forever? Emily and I would love, or all your therapists would love to keep you forever, but that's not realistic, right? So what we need to do is we need to work with you and get you independent in managing your symptoms. So home programs can help with that. That's our first step. But community exercise groups are also a great way that kind of help us bridge the gap. So once you've been discharged from PT, or you're in between bouts of PT, Emily says, come back in 6 months. What do you do in the meantime? You do your home program, and we encourage you to work in a community-based exercise program. So community-based exercise programs have been shown to decrease symptom severity, help improve your balance, your walking, and your mobility. And there's so many great options for programs. Some of these programs are like Tai Chi, meditation, dancing, yoga. There's a lot of great options. Even silver sneakers. A lot of communities have silver sneakers, and that's great. These groups can adapt the exercises and have you do them with your assisted device. If needed, you can do them in seated. A lot of these activities you can do in the pool. So there's a lot of ways to match you up with what your interest is, and also with your risk level, of course. So finding that right fit is the best thing. Of course, there's a lot of factors that go into it, like cost, driving, it can be, if it's far away, that can be an issue. But working with your therapist, we can help you do that. We have a lot of connections that we build over the years. Certainly, I've been a therapist over 20 years, so I know a lot of people out in the community, and I try to refer you to a community-based exercise program. And all the literature out there says that you can absolutely make some great gains by staying active with a community program. So that's our job, is to transition you from the clinic to a community exercise program. All right, we gave you a lot of info today. Thank you so much for hanging out with Emily and I and giving us the opportunity to speak. I hope that presentation really showed you some of the things that PTs can do to help you. Certainly, we haven't covered everything, but I hope that gave you kind of a good idea of some of the things that we can help you with. So thank you for having us.